Recognizes himself for 5 minutes for questioning. Thank all of you for being here. I'm so excited. This is the most excited I've been for a hearing in years. In fact, in 10 years since I've been a member of Congress. As many of you know, I'm a pharmacist. As many of you know, I'm the one who had to go to the counter and tell the patient how much their prescription was. I was the one who had to watch the senior citizen make a decision between buying their medicine and buying their groceries. I was the one who saw the mother in tears trying to figure out how she was going to pay for the antibiotic for her child. And I wanted to do something about that. And I have worked in the Georgia State Legislature, and I've worked here in Congress for the past 10 years to try to do something about that. I'm so excited to hear that everyone at least knows what a PBM is now. When I came here 10 years ago, I would say PBM, and people look at me like I had a third eye. Well, that has changed now. And it's not just, and I really want to compliment the chairman for calling this hearing and for the bipartisanship that you see here. Because, as Representative Kildee said earlier, we all want the same thing. We want accessibility, affordability, and quality in health care. People on this side of the aisle, people on that side, everyone in this room, we want that, and we want to make sure we get it. And it's not just in pharmacy. Yes, it is in drug pricing where you see where the insurance company owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor. You know who the largest employer of doctors is here in America now? United Healthcare. Almost 10% of all physicians in America work for United Healthcare. I'm just so excited to hear this. Dr. White, I want to start with you. We had a hearing, we had a member meeting of Energy and Commerce, and we had the director of CBO with us, and we had about 20 of you staff members there, and I asked this question, and I'm going to ask you the same thing. Give me one example of where consolidation in healthcare has saved money.
I can't think of one.
Thank you very much for that. Dr. Brueggemann, I described how the insurance company owns and the vertical integration that exists. And we see it. Again, we see it in prescriptions and drugs, but we see it all throughout healthcare. And this is the biggest problem that we've got. Do you believe it's a conflict of interest for the insurance company to own the pharmacy, to own the PBM?
Yes.
The vertical integration incentivizes the PBMs and its plans. Not only that, but it steers patients. Have you seen any example of patients being steered by the insurance companies? Any of you?
Yes. I mean, we certainly see that these insurance carriers will then steer it towards their own employed physicians or their surgery centers by providing financial incentives.
All right, let's shift gears for a second. Dr. Ippolito, I'm sorry, I know I butchered that, but nevertheless, 340B. You know, look, 340B program is a good program. It was intended for the FQHCs. It was intended for those who need this program. It has evolved into something that it was never intended for. And the current structure of 340B, and have you seen it, Dr. Brueggemann, Dr. Ippolito, have you seen where some of these healthcare systems are buying out practices for no other reason except to get the 340B pricing?
Yes, I've certainly heard the anecdotes, but I've also seen research that suggests that specialties that prescribe lots of relevant medications that you get for 340B prices have been acquired by hospital systems specifically in keeping with that hypothesis, yeah.
And you know, as the chairman pointed out earlier, it's innate in all of us, particularly in capitalism. And look, I'm not opposed to anybody making money. I get it. We live in a capitalistic society. And I understand that, and it's innate in wanting to make a profit and wanting to get the lowest price you can, but this is not being passed on to the patient. Dr. Petrozzo, you said earlier about transparency, particularly as it relates to PBMs, and making sure that the employer, the plan sponsor, sees the discounts that are being given and sees where they're going, and that the patient gets that discount. The patient receives it. Is that something you think would help?
Absolutely.
Good. One last thing. Dr. Ippolito, can you expand on the impact of consolidation on drug prices within the 340B hospital system and any negative impacts on the availability of provider services. Right now, there's a study being done by the FTC that finally, I requested it the first time I got up here, finally, they undertook a study about 2 years ago, a 6B study, to see the impact that PBMs are having on independent retail pharmacy, which is impacting affordability and accessibility. Do you see this with the 340B program?
At a minimum, I think it's fair to say the 340B program is perhaps not as targeted towards the types of care that it's supposed to be targeted towards. Hospitals certainly make quite a bit of money on it. It doesn't seem like there's a lot of evidence that that's translating to the kind of care that you're referring to.
Well, I don't want to abuse my time in the chair and go past my allotted time, but I want to thank y'all for being here, and I want to thank the chair especially for this hearing. I have not been as excited about a hearing since I've been a member of Congress in 10 years. Folks, this is serious. This is a problem. And again, the bipartisanship you see here, everyone wants the same thing. We want affordable, accessible, quality health care. That's all we want. I'll yield back, and at this time, the chair recognizes Representative Belen.